white blood cells, or leukocytes, have nuclei, and they also have all the other organelles that a normal cell has. However, they do not contain hemoglobin. White blood cells are classified as either granular or agranular. Remember, A means without, but they're classified based on whether or not they contain chemical-filled cytoplasmic granules that are contained within vesicles. So if you look at white blood cells under a microscope, if they look like they have lots and lots of little spots in them, they are called granular nucleocytes or granulocytes. These include the neutrophils, the eosinophils, and the basophils. Notice all of those have "phil" at the end. The agranular leukocytes or agranulocytes, when you look at these with a microscope, you don't see visible cytoplasmic granules. Now there are some in there, but they're very, very small, and we typically don't see those using traditional microscopy like we use in our A&P labs. Your agranulocytes include the lymphocytes and the monocytes. White blood cells in a healthy body can live for several months or a year, especially the lymphocytes. The lymphocytes hang around for a long time, and they sort of have a memory of what was successful before when they saw a pathogen and defeated it. So they can live in the body for a long, long time. But most of our white blood cells live only for a few days. During a period of infection, though, some of your phagocytic white blood cells may only live for a few hours. Your white blood cells are much, much fewer in number in the blood than the red blood cells. There's only somewhere between 5,000 and 10,000 per microliter of blood, where we saw with the red blood cells there were millions and millions in a microliter. Remember, our red blood cells were always within our blood vessels. However, the white blood cells can leave. So many of the white blood cells will leave the bloodstream and then collect at the sites of where a pathogen has invaded the body or in the site of inflammation. So when they leave the bloodstream, this process is called immigration or diapedesis. And that's basically just where, remember, they're flowing through the blood vessels and they roll across the endothelial lining of the blood vessel and they stick to it. And then they start squeezing out of the blood vessel between those endothelial cells that make up the blood vessel wall, and then they get out into the tissue where the pathogen has invaded the body. This is how they get out to the tissues that are infected or damaged, and they're able to launch their immune system attack on whatever that pathogen is. Just like when we looked at the red blood cells and talked about erythropoiesis, leukopoiesis is the production of those white blood cells. So your white blood cells, just like we saw before, are created from those hematopoietic stem cells, the pluripotent stem cells, the hemocytoblast. Remember, they are stimulated to create new blood cells when the bone marrow detects those high levels of chemicals. So how does that stem cell know to create leukocytes? It's because the body has released interleukins and colony stimulating factors that are specific to whatever's going on, whatever is wrong, what type of infection, what type of pathogen, what type of disease or disorder is needing leukocytes, white blood cells, to come in and fix it. Again, as I mentioned, a parasitic infection will cause an increase in the number of eosinophils, because eosinophils are the best soldiers to fight that battle. Other disorders, other pathogens, will cause an increase in some of the other types of leukocytes. So a particular interleukin or colony stimulating factor is released by the tissues that are being damaged, being invaded at that particular type. So the stem cells make that type of cell that will be most effective. So just as we saw with the erythrocytes, the stem cell gives rise to either a lymphoid stem cell or a myeloid stem cell, and your lymphoid stem cells, if you remember, only give rise to the different types of lymphocytes, and your myeloid stem cells give rise to all of the other types of leukocytes. So let's talk just a little bit about some of the terminology associated with leukocytes. Leukocytosis is when there is an abnormal increase in the number of white blood cells above the normal 10 to 11,000 per microliter. Now, leukocytosis is a normal and protective response to such stressors as invading bacteria or viruses, strenuous exercise. Even something like anesthesia or surgery can cause an increase in white blood cells. An abnormal number of white blood cells is known as leukopenia. Penia means shortage. So leukopenia is never beneficial, but it can be caused by something such as radiation or chemotherapeutic agents that, just like we saw with the red blood cells, the chemotherapy and the radiation can destroy the bone marrow and therefore destroy those stem cells that are found within. Leukemia refers to a group of red bone marrow cancers where we have abnormal numbers of white cells multiplying uncontrollably. This leads to an accumulation of cancerous white blood cells in the bone marrow. So the bone marrow becomes basically overwhelmed with the production of these blood cells, and it sort of interferes with the production of everything else. As a result, there are less red blood cells, so anemic conditions develop. Less blood clots or less clotting factors, your platelets, are going to be formed. The white blood cells that are made are not able to defend the body. So I often describe this in the classroom as sort of like sending a bunch of kindergartners out to fight a war. Yeah, having a bunch of warriors is good, but only if those warriors are capable of defending the territory. So making lots and lots and lots of white blood cells may sound like it would be beneficial, but because these white blood cells are not fully formed and capable of defending the body, it's not a good thing to have that many in the body, right? Don't send kindergartners to fight a battle. So leukemias can be classified as acute when the symptoms develop very quickly, or chronic where the symptoms may take a long time, even years, to develop. Leukemias are also classified based on which type of white blood cell becomes cancerous or malignant. So lymphoblastic leukemia is a cancer that involves the lymphoid stem cells, and myelogenous leukemias develop from those myeloid stem cells. The cause of leukemia is not really known, but there are some risk factors that have been tied to the development of leukemias. These can include exposure to radiation or chemotherapy for other cancers, some genetic disorders such as Down syndrome, environmental factors such as smoking, and then there are certain microbes, bacteria, and especially viruses that have also been linked to the development of leukemias. Mononucleosis is sometimes called the kissing disease. So it is a contagious disease that's caused by the Epstein-Barr virus. It occurs mainly in younger people, so children and young adults, and also more often in females than males. Most commonly, the virus enters the body through intimate contact, such as kissing, and that's where the name, the kissing disease, came from. The virus then multiplies in the lymphatic tissues, filters into the blood, and there it infects your B lymphocytes. Because these B lymphocytes get infected with the virus, they become very enlarged, and they start to look like monocytes. So that's the name. That's where the name mononucleosis came from. So you have an increase in white blood cell count, especially the count of the lymphocytes. And a lot of the signs and symptoms of this include tiredness and headaches, fatigue, sore throat, tender lymph nodes, fever. There is no cure for mononucleosis, but fortunately, the disease usually runs its course in a few weeks, as several of the viral infections will do. An increased amount of white blood cells usually indicates something's wrong. An inflammation, an infection, some type of disease or disorder, and the white blood cells have mounted a response. The army, the soldiers have been called in to fight the war, to try to get rid of whatever is causing the disease, the infection, the inflammation. So a physician may order a differential white blood cell count, or a DIF, which is just a count of each of the 5 different types of white blood cells. That helps to detect the infection or inflammation, but also can help to determine the effects of possible poisoning by chemicals or drugs, monitor blood disorders such as leukemia, can look to see if chemotherapy or radiation is decreasing the number of white blood cells, can detect allergic responses and parasitic infections. Remember, each type of white blood cell has a specific role in the immune system. So by looking at what the normal percentage of each type of these cells should be, taking a differential blood cell count and comparing actual to normal, it can help the physician to assist in the diagnosis of this condition. So here you can see each one of the 5 types of the the white blood cells, the leukocytes. You can see the phils, the ones with the very visible cytoplasmic granules, neutrophil, eosinophil, and basophil, and your agranulocytes, your lymphocytes, and your monocytes. Now we're going to look at each one of these as well as do a quick overview of the erythrocytes on the upcoming slides. Remember, your erythrocytes are your red blood cells, and you have somewhere around 5 million per microliter, depending on male or female. That amount varies just a little bit. They are biconcave, or sort of squishy little cells that don't have a nucleus when they're circulating, and they live for about 120 days, and the primary job is to create hemoglobin that transports respiratory gases. Your white blood cells, or your leukocytes, usually range around the 5 to 10,000 cells per microliter of blood, and of course each type has its own percentage. These usually only live for a few days, some of them only a few hours when they are in battle trying to defend the body. Some of your leukocytes, your lymphocytes, have a much longer lifespan. All of your white blood cells are your warriors, your immune cells. They try to combat the pathogens or foreign substances such as tissue transplants that are in your body that they don't recognize, so they defend against the invaders. We'll look at each one of the different types of leukocytes. Your neutrophils, remember, are the most abundant. So 60 to 70%, I'm sorry, I don't know why the word blank is on each one of these, but 60 to 70% of each of your white blood, or 60 or 70% of your white blood cells are neutrophils. They're called neutrophils because their cytoplasm, remember the cytoplasm is this part of the cell, the cytoplasm stains with both acidic and basic stain, so it's neutral. It's sort of a pale purple, sort of pinkish purple, lilac, depending on the stain, how much stain is taken into the cell. You also notice in your neutrophils that the nucleus, the purple, has somewhere between 2 to 5 visible lobes, and the granules are very, very small. Cytoplasm is pale. So what do your neutrophils do? They're your rapid responders. They're the bacteria slayers. So they phagocytize or eat pathogens. They destroy bacteria by secreting chemicals, lysozymes, enzymes that lyse, defensins, and oxidants that break down pathogens. So those numbers may increase if you have a bacterial infection or an inflammation. Burns and stress can cause an increase in your neutrophils. Remember, they're your first responders. They're the most abundant. Low count of neutrophils can be anything that destroys the bone marrow. such as the radiation, but there are also drugs and vitamin deficiencies, and even lupus can cause these numbers to decrease. Your eosinophils stain with a red colored cytoplasm. So here you have an eosinophil, cytoplasmic granules stain bright red. The nucleus is usually bilobed or has 2 lobes. Now, these make up only about 2 to 4% of all of your white blood cells. What do your eosinophils do? They help in allergic responses. When you are exposed to something that stimulates an allergic response, both your eosinophil number and your basophil number are going to increase. So your basophils are going to secrete histamine. Your eosinophils are going to sort of eat away some of that histamine, so the allergic response sort of stays in check. It doesn't get systemic or widespread. But another really cool thing about the eosinophils, their numbers increase if you have a parasitic infection, such as you get some sort of worm that's multiplying in your cells or in your body tissues. Then you're going to have a rapid increase in the number of eosinophils because they can help to destroy those. You also have an increase in eos during a lot of your autoimmune disorders. And just like the other cells, drug toxicity and anything that destroys bone marrow can lead to those numbers of eos being low. Your basophils stain with a basic stain, so the cytoplasmic granules are purple. Now, it's really hard to see the nucleus in the basophils because the cytoplasm is purple and the nucleus is purple, but it does have 2 large lobes with those really dark purple staining granules in the cytoplasm. So what do the basophils do? Basophils are going to secrete histamine and heparin and serotonin, all as a part of an allergic response, and it increases the inflammatory response, which is your body's way of trying to get rid of whatever's going on in that area. We'll talk more about the inflammatory response when we do a little bit more discussion of the immune system rather than just the cell types. So increased numbers of basophils can indicate that there's an allergic response or some types of cancers, such as leukemia. Numbers of basophils decrease sometimes during pregnancy or even just during ovulation, times of high stress, and, of course, anything that decreases the bone marrow stem cells. Your lymphocytes, there are 2 forms of lymphocytes, T cells, B cells, and then also we classify your natural killer cells as a type of lymphocytes. So these make up about 20 to 25% of all of your white blood cells. They are the smallest of all of your leukocytes. They are very small, round cells with a great big round nucleus. So the big purple blob you see here is that big old nucleus, and you see just a little bit of cytoplasm peeking out from around that nucleus. But what you don't see are those large visible cytoplasmic granules, because remember, your lymphocytes are agranulocytes. So these help to mediate the immune response. Your lymphocytes are also going to create antibodies. Your B cells specifically create antibodies, and those antibodies help invading cells, pathogens to be destroyed. Your T cells are pretty much direct warriors, so they're going to attack directly. So I sometimes say that the B cells are making weapons, antibodies that can be used. Your T cells use weapons, so they secrete chemicals that directly work on those pathogens. Your natural killer cells do the same thing, so they are direct attackers as well. So your lymphocyte numbers increase during viral infections and leukemias and such things as mononucleosis. Low counts can indicate a prolonged illness or HIV infection, because HIV infects your T cells. Also, immunosuppressant drugs that are given for certain disorders, and especially with transplants, can also decrease your number of lymphocytes. And then finally we have the second type of agranular cyte, and that is the monocytes. So the monocytes make up somewhere around 3 to 8% of your white blood cells. These are the largest of all the nuclei, or all of your leukocytes. So they are very, very large compared to all of the other cells. They have a very large U or horseshoe-shaped kidney. The cytoplasm is also very pale. And if you look really hard, you can see a few little stained dots in here, but you really don't see stained cytoplasmic granules as you saw with the eos, the basos, and the neutrophils. So what do your monocytes do? Again, they're the monsters. So their numbers increase during fungal or viral infections, tuberculosis and leukemias and other chronic diseases. When do their numbers go down? Anytime the bone marrow is destroyed. Or treatments with cortisol, if you have cortisol treatment for a prolonged period of time. So what do? Monsters, they wander out into the tissues and they eat. So they undergo transformation into cells that are known as macrophages, big eaters.